Hey everybody, welcome to another episode of the Bitter Pill, the show where we talk about bitter pills of truth that people don't want to swallow. And sorry about the long absence. As you know, this is, if you've watched the show before, this is a small channel, so I don't make money off of it. So I've been kind of busy just trying to, you know, make money and pay the bills. So me and my girlfriend and our bunny rabbit can eat and stuff. Um, but yeah, as always, although I've had a lot going on, I've been following political events closely, and two main things I've been paying attention to are, uh, of course, the Israel-Palestine conflict, so-called conflict. Really, as we know, it's a colonial power exerting domination over another group of people. Uh, so all the violence that's going on there, and as always, the pandemic, which, as regular viewers of the show know, I and my colleague Bob Sinclair have done research on the uh, social psychological dimensions of responses to the pandemic, both within the U.S. and Canada and cross culturally. Um, so the main thing I want to focus on today is uh, what I think, or what other people who know more than I do about these sorts of things think of the CDC's new mask policy, where they decided that uh, they were going to recommend that public spaces, businesses, and you know, government buildings and so forth no longer mandate that masks be worn inside those places by people who have been vaccinated, but still either mandate or suggest that people who are not vaccinated continue to wear masks. So I'm going to talk a little bit about that today. I do want to say a few words since it's been a preoccupation of a lot of us lately about the uh, events in Israel and Palestine. And basically, uh, obviously, I think that what Israel has done has been horrible. They invaded Al Aqsa Mosque, the third holiest site in the Muslim religion, during Ramadan, and assaulted the worshippers there, tear gassed them, and beat them, and so on and so forth. And continued policy of ethnic cleansing, of uh, forcing people out of their homes, not only in the West Bank, but even within uh, East Jerusalem, which I guess is considered to be part of Israel. Forcing them out of their homes, forcibly evicting them, quote unquote, even though they're not tenants, they're owners, with legal ownership of the land, but kicking them out in the Sheikh Jarrah neighborhood. And then, in response to this, Hamas, the uh, elected government of of the Gaza Strip, launched rockets at targets within Israel, military targets, to the extent that they were able, because they felt that this was unacceptable for there not to be any response to this gross violation of human rights by Israel against the Palestinian residents of East Jerusalem. And Israel retaliated with an intensive bombing campaign against Gaza, killing more than 200 people, overwhelmingly civilians. Not that those in the military wing of Hamas weren't perfectly entitled to forcibly resist what was happening under international law. An occupied population has the right to resist using force or violence if it deems necessary against actions taken by that occupier. So in any case, more than 200 people killed, hundreds of homes destroyed, hospitals damaged, the only COVID testing site in Gaza destroyed by bombs, media buildings razed to the ground, multi-story buildings which also had tenants in them. No word yet on whether people in the one that got publicity, the building that housed international media offices, whether anybody was killed. But just a horrible sequence of events, and then a tenuous ceasefire, which Israel already seems to be violating. But there seems to be, a new attitude internationally toward what's going on there, where more and more people, even in Israel's main supporter, the United States, are outraged by what's going on. So goodness, I've already taken over 5 minutes to talk about that, and that wasn't going to be the main subject of the conversation, but I had to say something. So getting back to the CDC's new mask policy. So again, basically, what the Centers for Disease Control is saying is that nobody who is fully vaccinated needs to wear a mask either indoors or outdoors, except on mass transit. There's still a mandate for buses and subways and airplanes, and I think a couple of other places. Unless a business chooses to mandate that everyone wear a mask. And as I discussed a few months ago, there's overwhelming evidence that masks work pretty well at reducing infection with COVID and reducing transmission of COVID by people who are infected, and reducing viral load, that is, the severity of the illness and the symptoms. For instance, an experiment with hamsters showed that when they put a barrier made out of mask material in between the cages that they kept hamsters in who were healthy from the cage of a hamster who was infected, that significantly reduced rates of infection and viral loads in the hamsters who were infected. If there was that mass material barrier in between the cages versus in the control group, randomly assigned control group, where there wasn't. Countries with national mask mandates have had lower death rates and lower confirmed infection rates. And American states that have adopted mask mandates earlier have had lower confirmed infection rates. And a state that adopted a mixed policy, Kansas, where they left it up to individual counties whether they mandated wearing masks in public indoor settings or not, found, a study of what happened in Kansas under that policy found that there were declining rates of confirmed COVID infections in mandate counties and increasing rates of COVID infection in no mandate counties. I can show you in more detail some of this evidence if you'd like. Let's see here. Face masks, what the data say. So, number of studies using various approaches, including lab experiments, show that masks are effective in reducing the spread of COVID and reducing symptoms in those who get it. Let's see. So, in addition to the animal study that I mentioned, there was also an observational study. Two hairstylists in Missouri tested positive for COVID. Both of them wore masks and kept working. I guess they were not that sick enough that they were laid up in bed or whatever, and they wore masks and required all their clients to wear masks. And although they passed on the infection to members of their households, none of their clients apparently were infected. We also have some anecdotal evidence that, and this probably has a lot to do with the fact that they were outdoors, but the Black Lives Matter protests last summer, the vast majority of the attendees wore masks, and there were no spikes in infections. But at the same time, there were cases where, for instance, kids went to summer camp, didn't wear masks, and obviously were indoors a lot of the time, and the virus really ran rampant. And a cross-national study of 200 countries found that increases in cumulative mortality for COVID were 4 times lower in places where masks either were recommended or mandated by the government or were just the norm in the population. And similarly, studies of state government mandates in April and May found that states that had mandates had lower rates of growth of COVID cases, significantly lower rates. And I should add, all of this in the United States and in many other countries had a political dimension. Not only mask wearing, but other public health measures such as lockdowns and so forth. Now, you wouldn't think that people's attitudes toward measures designed to protect public health, such as requiring people to wear masks in indoor public settings, would be political. But it has been very much turned into a political issue. So, in the United States, for example, overwhelmingly, Republicans are more resistant to wearing masks, are more resistant to getting vaccinated, are more resistant to so-called lockdowns, just sort of a blanket term to refer to restrictions on the number of people that can go inside of businesses and closures of businesses during the pandemic and closing of borders and so on and so forth. Much more resistant to that among Republicans. And my colleague Bob Sinclair and I, as we've talked about on the show before, have shown in our research that states that were more Republican-leaning, states that wound up voting for Donald Trump in the November 2020 general election, were much more resistant to mask mandates or other public health measures. More prone to protest against them, for example, and on average later to adopt mask mandates, if they adopted them at all, than states that voted for Biden. And just, if you don't know, but all of you who watch this channel or know me online or in real life know, I didn't vote for either one of these clowns, either Trump or Biden. I'm just stating a fact that states, according to our data, which came from publicly available sources, states that voted for Trump had higher or had later or non-existent mask mandates than states that voted for Biden. And in addition, those states that voted for Trump or that's had late or never mask mandates had higher rates of confirmed COVID infection. We found that in our data. Other researchers have found similar things. But as I mentioned in the main topic of this video, the CDC dropped indoor mask recommendations, the indoor mask recommendation or guidance for vaccinated people. Why did they do that? Let's take a look at their justification for it. What the hell? No, we don't want that. Here we go. So, let's talk about what scientific research led up to the CDC's decision to lift mask mandates. Well, as I've talked about on this show before, lots of evidence from clinical trials that people who have been vaccinated, especially if they've been fully vaccinated, it's been a couple of weeks since their second vaccination, are much less likely to be infected with COVID than people who have not been vaccinated. So, for example, the Pfizer and Moderna clinical trials involving tens of thousands of people randomly assigned to either get vaccinated or not get vaccinated found that well over 90% of people were well over 90%, 94 or 95% less likely to be infected with COVID than people who were not vaccinated. In addition, more recent research that the CDC director Rochelle Walensky cited indicated that 3 recent studies indicated that both asymptomatic and symptomatic infections were much less likely in vaccinated people, and in addition, the recent COVID variants that have emerged that some scientists were worried might be able to evade the vaccines seem to be kept well in check by the vaccines that are being used in the United States. And people who do get infected with COVID, who are vaccinated, a few people that do are according to this research, much less likely to be hospitalized or to die than people who have not been vaccinated who get infected. In addition to that, excuse me, research has also found that and I have a image somewhere of summarizing data on this. Let me see if I can find it. Showing that transmission is far less likely in people who have been vaccinated should they get infected. Like 80 to 90% less likely. I thought this article mentioned that, but it didn't. Anyway, hopefully you'll take my word for it. So, they wouldn't have done this if they didn't have evidence. And my recollection is there are about half a dozen studies that have shown that people who get infected despite having been vaccinated, a few people who do, have much lower viral loads and are much less likely to spread the infection to other people than people who have not been vaccinated and get infected. The change in recommendations was overdue, according to Dr. David Dowdy, an associate professor of infectious disease at Johns Hopkins. I think part of the problem before was that there was something of a mixed message. The vaccines are very effective, but you still have to wear a mask, Dowdy said. This is now a strong statement that we know these vaccines work, and for those who are fully vaccinated, it's appropriate to take some steps toward living a life a bit more normally. And there are people who many of us know through social media who agreed with the CDC's advice. For instance, Jimmy Dore, um, independent podcaster Jimmy Dore, said the governor of California is not following the science or CDC guidelines on masks. I thought only red states thumbed their nose at COVID science. Weird how none of the shit libs are pillorying him for it. And what he's referring to is that California is, at least for the time being, keeping their mask mandate in place. Jimmy also said, I find it weird, Jesus, I don't know why my computer does this, that for the past year, if you question the CDC guidelines for COVID, for any reason you were labeled an anti-science conspiracy theorist. Now it seems everybody gets to question the CDC guidelines without scorn. What changed? Similarly, Glenn Greenwald said, I don't know why he's doing this, but anyway, he said, for the last year, anyone questioning, let alone rejecting CDC, World Health Organization guidance on COVID was vilified as an anti-science crank, to the point of being censored off the internet. Yet it's now totally common for liberals with no scientific training to go on TV and reject new CDC guidance. Now, I get why what Glenn and Jimmy's point is, about the hypocrisy of people being attacked for questioning the CDC's recommendation that people wear masks throughout much of the past year, and now people who are questioning the CDC's new guidance that says if you're vaccinated you don't have to wear a mask are not being vilified as anti-science cranks or censored and whatnot. Well, okay, yeah, but I mean, this seems to presume, as Jimmy clearly does, that there's a scientific consensus in favor of the CDC's guidelines on masks. And, I've tried to tell you this, Jimmy, and Glenn too, but there isn't a scientific consensus on this at all. So the article that Jimmy cites here from sfgate.com extensively quotes a professor at University of California, San Francisco, who agrees with the CDC's decision and says San Francisco should immediately lift mask mandates for for vaccinated people. And the scientist is Dr. Monica Gandhi, who did some research on masks where she showed in her data that wearing masks reduced viral load or seriousness of infection in those who wore masks and did get infected. So she says, there's immense collateral damage that comes from not easing restrictions after most people are vaccinated. It sends a message that there's still a danger when there isn't one, and then schools remain closed and businesses suffer. Some collateral damage from restrictions needed to occur when we didn't have vaccines, but now that we have them, there's no justification. Apparently, Jimmy Dore thinks that what Dr. Gandhi is saying is gospel, and anybody who goes against what she's saying or what the CDC is saying is being anti-science. Let's take a look at what other scientists are saying. And there's lots of debate, lots of conflict. But I should also say, as a social scientist, what I thought of, and also what a lot of scientists who are, researchers who directly study COVID itself are saying, thinking the same thing is, um, you know, in practice, when you say, okay, if you've been vaccinated, you don't have to wear a mask indoors anymore, or businesses shouldn't necessarily require you to unless they just want to. Is In practice, that means nobody's required to wear a mask. They can say, if you're unvaccinated, you don't have to wear a mask, or you do have to wear a mask. But unless they're actually checking people's vaccination status, asking for your vax card or whatever, they're just having to take your word for it. And so because there's no enforcement mechanism being proposed at all, people who are not wearing a mask, or are not vaccinated, can potentially feel free to flout any requirement that they wear a mask if they're unvaccinated, because nobody's asking them if they are vaccinated. And so the predictable outcome of this is many businesses have already simply dropped mask requirements completely, because they don't want to lose business. They want to encourage people to come in, more so by not requiring them to wear a mask. And I'll just mention my own experience here locally in Bloomington, Indiana. A international grocery store that's near where I live, World Foods Market. You dropped their mask mandate, and they just have a sign on the door that says masks suggested or recommended. I forget exactly what it says, but it doesn't require anybody to wear a mask. The Kroger near there, also very close to my house, doesn't have any signage about masks whatsoever on the door anymore. Despite that, the last time I went in that Kroger, most of the people were wearing masks, and everybody was at World Foods Market. And the Kroger on the other side of town, as well as Target, are basically just stating what the CDC's policy is in their signage on the door. You're required to wear a mask still if you haven't been vaccinated, but if you haven't been vaccinated, but if you have been vaccinated, you can feel free to not wear a mask. I'm still wearing a mask, even though I've been vaccinated for a couple of reasons. One, I just want to encourage that norm continuing, given that only about 40% of Americans have been vaccinated so far, and masks provide additional protection. So I kind of think of it like birth control. If you have two measures to prevent women from getting pregnant, and neither of them work perfectly, so let's say condoms and spermicide, why would you say, okay, well, condoms work more than 90% of the time if you use them correctly. So I just won't worry about spermicide because condoms work pretty well. And why would you do that? If you are genuinely interested in not getting anybody pregnant, why would you give up one of two pretty effective but imperfect measures to prevent pregnancy? You wouldn't. So why are we doing that here with vaccines? Because vaccines don't work perfectly. They have very high effectiveness rates as far as preventing infection. And if you do get infected, you're not likely to have a severe case or to spread it. The research is all showing that overwhelmingly. But, they're not perfect. You can still get infected. And there's not much chance of it, but if you are infected, you can still conceivably transmit that infection to someone else if you are vaccinated. Similarly, masks have been documented in many, many studies to reduce the chances of getting infected with COVID or passing that infection on to somebody else or having a severe case of it. Works pretty well for all that, but it's not perfect either. You can still get infected if you're wearing a mask, especially if other people around you aren't wearing a mask. And somebody that I know through social media, Jen Dyes, one of the um, uh, journalist who does the Status Quo podcast, got infected at an event where Rudy Giuliani was speaking back in November. Despite wearing a mask, she got, pretty seriously infected, and she's been somewhat sick ever since. She's got long COVID. She's got symptoms many months later. So masks don't work perfectly. Vaccines don't work perfectly, although they work pretty well. So why would we give up one of those measures, given that neither of them works perfectly? In situations where we could possibly be around other infected people, at least as long as we've got tens of thousands of documented new cases of COVID every day in the United States. One could argue that dropping the mask requirement for vaccinated people is premature just in and of itself. But the other thing, and this is the social psychology of it all, is, since nobody's asking whether you're, or requiring proof that you're vaccinated, people who don't like wearing masks but also don't want to get vaccinated might be tempted to you flout mask rules for unvaccinated people when they go shopping or go to work or whatever, and just not tell anybody that they're not vaccinated. Obviously that's a possibility. And that's not just my opinion. There are a lot of people who know a whole lot more about COVID and its transmission than I do, who have expressed similar views and said, indicated probably this is premature. Article from the New York Times surveyed hundreds of epidemiologists, and this was shortly before the CDC's mandate that they did the survey, but the epidemiologists that they surveyed said they thought that everybody should keep wearing masks. 80% said they thought that people needed to wear masks in public indoor places for at least another year, whether vaccinated or not. Only 5% of the epidemiologists interviewed said people would no longer need to wear masks indoors by this summer. Of course, it's not even officially summer yet, and already the CDC has said they weren't needed. Scientific American just published a column where the staff of Scientific American, who generally are trained scientists and also are vaccinated, talked about whether they planned on keeping their masks on in public indoor spaces despite being vaccinated or not, and why. And I say, we, the staff at Scientific American, are mostly, if not completely, vaccinated against COVID-19, and we're grateful and relieved. An enormous amount of evidence shows that we are almost entirely protected from severe illness or dying of COVID, and more coming out all the time shows that we're highly unlikely to pass the virus along to other people. According to the CDC, it's safe for us to stop wearing masks in most situations, but it's not that simple. Okay, so Amanda Montagna, as Associate Graphics Editor, said, I'm thrilled to be vaccinated and be able to take my mask off outside, but when I take my 2-year-old to any public indoor setting, I'm still going to worry about exposing him to unmasked people whose vaccination status I cannot know. I will encourage him to... even though young kids don't tend to get very ill from COVID, the risk is still there. And right now, kids under 12 are not vaccinated against COVID, and not very many kids between 12 and 18 are vaccinated. Um, and even though young kids don't tend to get very ill from COVID, there is that risk. You know, uh, kids overwhelmingly don't die from it, but you'd be surprised how many young kids do get seriously ill from COVID, even though they're not likely to die or to have long-term significant symptoms. Um, it's not that rare. I don't think it is. Um, and even if my son ended up with a mild or asymptomatic infection, I would hate for him to spread it to others at his daycare. I will encourage him to wear a mask and will happily model that behavior by wearing mine. Um, so I would really prefer everyone stay masked indoors until more of the population is fully vaccinated. And pretty much all of these folks, I won't read through all of this. Um, you know, the editors and other staff said, I'm going to keep wearing a mask indoors. Gary Sticks, senior editor, said, I don't like wearing a mask. Having one on fogs my glasses, even in summer. I've had the same experience. So I just go into stores without my glasses, generally. Um, and says, even so, even despite really disliking to wear a mask, I have worn a mask since it was recommended by public health officials last year and haven't thought twice about it. I will continue to wear one if it's required by a business or if it's the protocol for a party or other social event. I will be very glad when it becomes somewhat clearer as to when it is okay to take off face coverings for good, but I will put one on again without protest if needed to protect others or myself. I'm not thrilled about mask wearing. Blah, blah, blah. Yeah. Anyway, Laura Helmuth, editor-in-chief, says, I'm fully vaccinated but will wear a mask for the foreseeable future whenever I'm in enclosed spaces among strangers. I don't know if I can trust them, and they shouldn't have to worry about whether they can trust me. In other words, other people don't know that you're vaccinated. They may think you're not. Or they just don't know. So, why worry them? Is her reasoning. It's a small, simple thing that has become a huge political signal, but fundamentally it signals that we care about other people, including their anxiety level. The National Nurses Union condemned CDC's rollback on COVID protection guidance, stating, let's see. This newest CDC guidance is not based on science, does not protect public health, and threatens the lives of patients, nurses, and other frontline workers across the country, said NNU Executive Director Bonnie Castillo. Now is not the time to relax protective measures, and we are outraged. So the CDC has done just that while we are still in the middle of the deadliest pandemic in a century. Some of the concerns that they cited were that there continues to be a high number of COVID cases. It's under 30,000 new infections daily on average now, so it's the lowest level that it's been since early last summer, but it's still a lot. Deaths are at their lowest level since last July, I believe, early July of last year, but it's still almost 600 people a day. There are variants out there that are more transmissible and possibly more deadly. And they say they may already be or may become vaccine resistant. The evidence suggests that the variants that are out there are not vaccine resistant at this point, but as they say, new variants could evolve that are vaccine resistant. Let's see. The CDC recognized scientific evidence on aerosol transmission, but refused to update guidance based on science. Nurses say the CDC needs to fully recognize aerosol transmission and update its COVID guidance accordingly to prioritize measures that prevent and reduce aerosol transmission. So they're saying basically, It's a lot more transmissible in poorly vented indoor spaces than we first thought. It can spread over a wider distance. And given that, we shouldn't have anybody not wearing a mask indoors, especially people who are not vaccinated. But again, you can't track who is or isn't vaccinated unless you require proof. Preventing and reducing transmission of COVID requires multiple layers of protective measures. Nurses say this includes masks, distancing, and avoiding crowds and large gatherings in addition to vaccines. So vaccines are only one important component of a robust public health infection control program. So they say all our protective measures should remain in place in addition to vaccines. Just to be cautious and to basically, for all practical purposes, zero COVID out before we drop the mask mandates. There are other countries, as I've talked about on the show before, that have done that. China did it, New Zealand did it, Vietnam did it. They basically wiped COVID out even before there was a vaccine by taking very strict public health measures, mask mandates, and quarantining anybody that traveled into the country until it was for sure that they weren't going to acquire an infection and pass it on, restrictions on public gatherings and so forth. They did all that for a few months at the beginning of the pandemic, and then they were able to just completely get rid of any of that stuff other than tracking and contact tracing of any isolated cases that popped up, which the U.S. has done a terrible job of contact tracing. Other countries have done very well with it. So, you see these images of people in China, all packed together at, a religious ceremony, celebration of Eid in Western China, at water parks, all kinds of public spaces. No mask, no physical distancing necessary because they've wiped out COVID. Same thing in New Zealand. I saw a image of a gigantic concert, tens of thousands of people listening to some artists, all packed together, no masks. They don't need it because they've gotten rid of COVID. We haven't even come close to doing that here. The nurses say this is premature. Let's look at what other countries say. Face masks needed in the UK until 2022, says poll of disease experts. Just overwhelmingly. They say mandatory wearing of face masks in shops and on public transport will probably stay in place in the UK until at least 2022, predict a majority of infectious disease experts polled by New Scientist, and moreover, they said they should be. In Israel, which, as we've already talked about, is terrible in terms of its human rights violations, but one thing that they have done that, at least I think they did right, is that they vaccinated the overwhelming majority of their population. And so as a result of that, they dropped the mask mandate that they had for public crowded outdoor spaces. But, despite the fact that they have a much lower rate of COVID infection than we do here in the United States, I forget exactly, but it's something like a tenth the rate of infection that we have here. They still have indoor mandates for everyone, vaccinated or not, to wear a mask indoors. And they're fine with that. But one thing I should mention while I'm on the subject of Israel again is Israel has a very high vaccination rate, but they have the Gaza Strip, where 2 million Palestinians are crowded in a space that's something like 25 miles long by 5 miles wide, one of the most densely populated areas in the world. And Part of that blockade is that they're blockading medical supplies coming into Gaza, including vaccines. So only about 1% of the population of Gaza, and I guess that's true in the West Bank as well, has been vaccinated. Um, well, probably almost nobody in Gaza has been vaccinated. It's probably the West Bank where most of the vaccinations have taken place because they're not totally blockaded. Um, you know, and meanwhile in Israel, more than 60% of the population is fully vaccinated. That's exactly what you would expect a colonial power that wants the people it's oppressing to die or get sick, without being obvious about the fact that they have genocidal intentions. That's what you would expect them to do. If they want the group that they're oppressing and occupying to die, and they themselves want to live, that's exactly what you would expect them to do. Vaccinate themselves, refuse it for those they are oppressing. But anyway, back to mass policies in other countries. I mean, you can go down the list. Mass mandates by nation. Most still await a breath of fresh air, meaning in the vast majority of places outside the United States, the one exception being the United States, where vaccinated people don't have to wear a mask anywhere. But in China, even though they've done away with COVID and don't require people to wear a mask outdoors, or even when they're in indoor spaces that have documented good air circulation, they still have to wear masks. They're still mandated to wear masks in hospitals and mass transit, and to wear them if they come within 1 meter of people at, for example, a shopping center or at work. Japan, same story. They don't have a national mask requirement, but they recommend and many businesses require continued mask wearing by everybody, whether they've been vaccinated or not. Germany still is requiring medical masks in any indoor public space or public transit and so forth. India, same thing in most states. The UK, which drastically reduced its rate of COVID through a combination of a 4-month lockdown and mask mandate and extensive vaccination campaign. They're still requiring masks to be worn and are fining people for not wearing them in public indoor spaces. France, same thing. Italy, same thing. Brazil is a little looser, but some cities and states require it. Canada, requires it. The regulations do vary by province there, but they pretty consistently require masks. South Korea, mandating masks at nearly all times, regardless of vaccinations. Australia, it's mainly in public transit that they're still requiring it, but they do put mask mandates in place if they have outbreaks of COVID. Spain, masks are mandatory for everybody, both indoors and outdoors, regardless of vaccination status. And so on. Vast majority of countries around the world continue to require masks indoors. I'm not saying that the U.S. is necessarily wrong to be such an outlier. We will see. but it seems like a huge risk. Um, we're probably not going to wind up like India, which is, although it did much better than the U.S. early in the pandemic, now the situation is horrible because hardly anybody's vaccinated and they have a highly infectious variant going around. So a huge number of deaths, even though the population is quite young on average in India. Um, we're probably not going to go that route because lots of us have been vaccinated, but we might not have as much success getting rid of the virus as other places that are being more cautious. Um, it seems like what they're thinking was, you know, is they're gambling that dropping the wear mask in indoor public spaces a recommendation for vaccinated people will encourage more people to be vaccinated. Now I hope they're right, but again, it seems like you know it's a little premature, arguably, and many experts agree with me. I'm not claiming to be an expert on COVID. Um, it seems a little premature to me and to many experts. When 60% or so of the population at this point is not vaccinated. Especially considering the possibility of a more vaccine-resistant variant arising. Um, so, so we'll see. But at this point, I'm skeptical that this was a good decision by the Centers for Disease Control. All right, well, that's all I had to say for this time, and I will definitely put some links to some of the uh, articles that I've gotten information from in the description of the video. Please like and share and subscribe, and I will talk to you again soon.